Hello there, I'm Dr. Deuk, and today is September 30th, 2019. I'm here with one of my patients that had surgery performed on his neck, and he's agreed to be videoed. He had a posterior cervical laminectomy infusion. His spinal cord was being crushed. He had had a prior ACDF through the front, not by me, and he had problems there as well as the discs above and below. And he really wasn't a laser surgery candidate, he was a fusion candidate. And so, how are you doing today, 3 months after your surgery?
You know, the results for the surgery are far better than I would have anticipated. The results are exceptional. I mean, I feel great, and I've had pain for so long that it's just really nice to be pain-free. When I say I've had pain for so long, that's not really fair because I was involved in an accident which caused the pain. But can we start this over?
No.
I'm about to screw
It's okay.
myself.
Just keep talking. It's all natural. Just get it out.
Well, I had a fusion in 2005.
Yeah.
And I had some neck pain off and on now and then. Then when I had the accident, evidently the accident separated the fusion. Then I had severe pain in my neck as well as numbness in my left arm. And when I say severe pain, nothing like I'd experienced in the past. And I had numbness in my left arm and terrible pain in both shoulders, both on the left and right side. And all of that has subsided with the surgery.
Yep.
I have no numbness. I have no pain in my shoulders. I have a very small amount of pain, maybe every other day, just a little bit. It's probably not even a 1 pain. It's probably between 0 and 1. Good.
So the surgery we did, the fusion in the back of your neck, a posterior cervical laminectomy infusion helped.
It was a miracle.
It was a miracle. Good. Well, that's what we try to do at Deuk Spine Institute, is improve people's lives. And anything else you want to say? I think that's great.
Just that we were very lucky to find you.
And I was lucky to find you.
As a matter of fact, we couldn't figure out where to go. We were running all over the place trying to find a good surgeon. And somebody gave us your name, and had they not, who knows where we would have ended up.
Well, I'm very happy you're here and that you're doing well. That's what we're here for.
I'm doing excellent.
Good to see you, sir.
Good to see you.